Welcome to PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso. In today's show, we're going to be talking about public health in the trenches in Georgia.
In our first episode, we talked about the development of this new Department of Public Health, a groundbreaking event in this state.
Yes, and we'll be following up our conversation with Dr. Fitzgerald, who's the Commissioner of the new Department of Public Health, and we're going to be asking her to tell us a little bit about the infrastructure of public health within Georgia, and then what her vision for the state really is around public health.
We'll talk about these levels of public health at this new state Department of Public Health, and of course the district public health departments, the counties, and then you on the individual level who's an advocate for public health too.
And you know, advocacy can be something as simple as going to your children's school and asking for more fruits and vegetables to improve the nutritional intake of your children.
Or it can be for clean water. You know, the only thing that separates a developed country from an undeveloped country, really, one of the main things, is clean water. You can't take that for granted. You have to be an advocate for that as well.
And in this show, we're going to show how public health advocacy really goes hand in hand with health communications. These are both really important competencies with public health, and it helps us deliver those important public health messages into the community so that people can hear them and actually change their behaviors to improve their health.
So this is the public health agenda, and that's what we'll be covering in this episode of Public Health Impact.
We're back at 2 Peachtree, the home of the new Department of Public Health, and I'm here again with Dr. Brenda Fitzgerald, who is our new commissioner. And Dr. Fitzgerald, I just want you to know that you're a role model for me, and I'm sure for many other people, and women in particular in public health. So could you tell us a little bit about your background and how you got to be the commissioner?
Well, thank you for that. I got to tell you, this is the most fun job I've ever had. I'm very pleased to be here. I am a board-certified gynecologist. I have been in private practice for 30 years. But during that time, I've always been involved in policy. I was the chair of the Georgia Public Policy Foundation, for example, because I've always known that you can't do good medicine without good policy. So when the new governor was elected, when Governor Deal was elected, he asked me to look at the medical aspects for the transition team for his new administration. And one of the things I looked at was public health. And to be honest, there were some problems in public health. There were some problems with organization. There were some problems with it, in my opinion, not being able to fulfill its destiny. And so I reported that to the governor, and he came back after that and asked me to be the head of it.
In our last show, we talked about the formation of the new Department of Public Health, and today I wanted to ask you about the public health infrastructure in the state of Georgia. What does that infrastructure look like?
Georgia has a federated structure, and what that means is there is a state department. We have 18 districts in the state with state employees, and then we collaborate with the local county structure, and each county has a county board of health that oversees the health department in each county.
So that means that all the employees at the district levels are all state employees, or do they have some of their own county level or local level employees as well?
They have local and state employees. It's a federated system, so it's a collaborative, cooperative system.
And so does that also mean that it's financially collaborative? So in other words, is it the state that's financing all of the structure or partial?
It's partial. We have in public health, 70% of our money comes from the federal government. So 70% of our money comes from the federal government in forms of grants. A major portion of our money comes from the state, and then at the local departments, those local county organizations contribute money to their local public health department.
And I can imagine that in our economic downturn that we've been facing these last couple of years, that public health, just like all of our other departments, is suffering. And I wonder how are the local public health departments dealing with this, or at the district level? Are they doing it alone, and how's that faring?
Well, no, they're not doing it alone. And one of the nice things about being a separate department in a state organization is that we have the ability to bring together different groups of people to solve problems. For example, infant mortality is a major problem in Georgia. We are the 8th in the nation in problems with infant mortality. We have identified, the state has the data. We have looked at the pockets. We have identified 6 pockets of infant mortality in this state that are particularly worrisome. For example, the average that the state has of infant mortality is 8 losses per 1,000 births. But in these pockets, there's 17, for example, per 1,000, twice as much. So in Valdosta, which is one of those places, the state is going in with our information. We have the information on exactly where the mothers live that these problems come from. We are meeting with Dr. Bill Groh, who is the state health department in that district. He's bringing together the pediatricians, the obstetricians, and other community groups so that we can have a real impact on infant mortality in that area.
That's a great example of a public and private partnership.
Absolutely.
And is Georgia like every other state in terms of their public health infrastructure?
No, they're really not. There are some states that have absolutely no service whatsoever. The public health in those states is simply an advisory board. It's a state organization at the Capitol, and all they do is give advice. There are other organizations where the state from the Capitol runs the departments and does the work throughout the state. Here in Georgia, again, we're a federated system, so it's a collaborative, cooperative system.
So is it the case then that at the district level you've got all these counties that are within a district? Do they share delivery of services to make it more efficient?
Yes, sometimes they do, especially in rural Georgia. For example, in the Waycross district, we have a lot of counties there, and we have telemedicine. We've put in telemedicine there. So we have one infectious disease doctor, and he can see people in each of those counties using telemedicine. They've also used teledentistry in that community, because in that particular community we don't have enough dentists to see all the children. So we can take our teledentistry machine, take it to the schools, and the kids are saying, you know, look at my teeth on TV, and they're real excited. And we can do screening programs, and then we can refer those children to dentists in the community.
What have you recognized as some of the most important ongoing issues in the state?
Well, I think the most impressive thing to me is that every single day, every single Georgian comes in contact with the public health in one way or another. Every time you go to a restaurant, public health has been there and inspecting it. Every time you sleep in a hotel room in Georgia, public health has been there inspecting it. Every time you swim in a pool, every time there's a child born, 28 tests are done within the first 3 days of that child's life by a public health employee. When you get married, when you get divorced, when you adopt a child, public health is there because we do vital records. So every single day, in a lot of ways, public health is there for every single Georgian.
It's such a good point, because I think most people think, hey, I don't go to the public health clinic, so therefore, you know, I'm not engaged in the system, but
right.
But they really are.
They really are.
So, you know, Georgia, we have this wonderful, unique landscape. We've got a lot of coast. What are we doing to prepare for natural or man-made disasters in the state?
We're doing a lot, and public health is responsible for the medical responses to all emergencies. We, for example, had a governor's practice session where all the agencies got together and we practiced. We had an example where we had a hurricane hit on the coast. We have ways, for example, to evaluate the medically fragile. I mean, you know how much problem there can be with directing traffic if you are evacuating, but imagine evacuating people from nursing homes, people who are in hospitals, medically fragile people. So public health is in charge of that, and we're responsible for helping with providing medical care during those emergencies. We're also responsible for man-made emergencies. We are responsible for evaluating and protecting the state from bioterrorism. For example, in Atlanta, we have air monitors that monitor the air quality. So if there is a biologic attack, public health is responsible for finding that. And we have ways to respond to those terrorist attacks.
Well, what are some of the ongoing public health issues? You've mentioned a few already, but what are some of the, walking in as the new commissioner that you immediately recognize as something that needs to be tackled?
I think the most important one is obesity. Now in Georgia, 65% of Georgians are either overweight or obese. It's a very important health issue. It's a very important economic issue. If you have increased weight, you have increased problems with diabetes, increased problems with hypertension, heart disease, a stroke, cancers. It really is a major, major problem. I think it is rapidly becoming a greater risk to us than even smoking. So we are looking and working with the governor's office to come up with a statewide program to look at obesity in Georgia. It is very worrisome. Our children, our teenage children, we have the second in the nation worst problems with obesity in our children. Mm-hmm. Major problems. What that may mean is that those children may not live as long as their parents. So I do not want to be the health director in an era when it's the first time in history where children have not lived as long as their parents.
Wow. I wish you the best of luck on tackling that very important problem, and thanks again for your time today.
Thank you for being here.
We've had a chance to talk with Dr. Fitzgerald to learn about public health infrastructure at the state level. Now we're going to narrow our focus a little bit and look at public health at the district level. I'm being joined by Dr. Claude Burnett, who is the director of the Northeast Health District. Thank you so much for joining us.
Glad to be here.
I guess my first question for you is, we now have a new Department of Public Health at the state. What does this mean for the districts? Do you expect things to stay the same or be different? And if they are going to be different, what will change?
Well, I would say probably the biggest change will, from an operational level, will be we won't have to wait so long to get decisions made. In both DHR, Department of Human Resources, and Community Health, our public health staff would have to ask somebody else if they could do something. So I think there'll be fewer layers and things will happen more efficiently than they did before.
Okay, so that brings me to my next question is, what are some of the roles and functions of a district health office that are unique to your office that maybe the state's not covering or not doing, or that the local county level health departments aren't covering either?
Well, we oversee the county health departments. I have 10, and probably the predominant job is to serve about 60,000 people every year, nearly 20% of the population. And over a 5-year period, we see nearly half the population for one service or another. So there's a great emphasis on taking care of those people medically and educationally.
So talking about services that you're delivering at the district level, can you give us an example of what kind of services you're talking about?
Sure. Like I said, a large proportion of the population comes to the health department every year. Number one reason is for immunization. That's changed, where we used to do a lot of new baby shots, but now we do more shots for kids staying in school and going to college, but also a lot more flu shots and pneumococcal shots for older people.
So what are some of the more interesting public health activities that you're currently engaged in?
I have an interest in teen pregnancy prevention, and we've recently had a big boost from community efforts on that. Heidi Davidson, the mayor of Athens, established a poverty commission here locally because Athens has a disproportionate amount of poverty compared to most parts of the state. Mm-hmm. And that commission, or that activity, tried to deal with schools and jobs and housing, and health was one of the pieces. And the community seemed to respond positively to the fact that we have a very high teen pregnancy rate, much higher than both Georgia and the U.S., and there needed to be more education in the schools for teens. So there was a big effort there, and the school board was very responsive. And we've seen a number of our counties respond to that same theme, and it's echoing throughout our district. So we're seeing a lot of effort there.
So I love the idea that the interest in teen pregnancy is being, taken up by the counties. Is that always the case? I mean, how much of your job is just, coordinating the efforts across the counties, getting people on board to the public health message? Is that an easy thing to do, or are there challenges in bringing the counties together for the same mission?
I would say that's an exceedingly difficult thing to do. First of all, we don't have much money for advertising, and it takes a good deal of time to get interested people together. So the mayor's initiative was very helpful. And we've also, something that might be a little different about our district, we've done a lot of surveys of the population and also students in school. So we know a lot about what people think, and that has been very supportive. The population overwhelmingly feels that sex education should be present in the schools, comprehensive sex education, like 90%.
Wow.
And they're also very supportive, about 2/3 support having a clinic near the high school. So we've had a number of counties offer that and actually create clinics from local funds.
Are there any emerging public health issues that are of particular importance to the district, or you think that the state needs to be watching closely?
Well, I think we're all aware of the growing epidemic of obesity. Also very aware of the shortage of funds nationwide and the fact that healthcare costs are going up almost exponentially. And coupled with the aging of the population, those are all going to be very challenging issues.
I'm going to kind of switch topics here for a second and ask you about the Affordable Care Act that passed last year. Do you see there being lots of opportunities for funding or any other types of pieces of that legislation that can help out at the local level?
Well, we have yet to see what the real effect will be, but there is substantial funding for public health infrastructure, which I'm glad to see. We have recently been told at the state level that there's going to be less funds for treating hypertension, and we hope to maintain that activity at the local level, but we're told that in a few years there may be renewed federal funding because that is so cost effective to both reduce obesity and control hypertension to avoid very expensive subsequent problems like stroke and heart attack and kidney failure, which cost the feds a great deal of money.
Well, thank you for that insight on what's happening with public health at the local level.
It's my pleasure.
We now have with us Mr. Charlie Hayslett, who is the chairman and CEO of the Hayslett Group, which is a public relations firm, and he's also the manager of the Partner Up for Public Health campaign. And I'd like to hear from you, Charlie, about what is this Partner Up for Public Health campaign all about?
First of all, it's good to be with you. And the Partner Up for Public Health campaign is a public advocacy and will-building campaign funded by Healthcare Georgia Foundation that we've been managing for about the past 2 years. And its purpose is to try to raise understanding and awareness among leaders in the state and the general public to a significant degree about the significant challenges that the state's public health system has been suffering with for a long time.
Health communications is such an important part of our competencies in public health, so I'm just so pleased to hear that there's someone actually doing this in the state. Can you give me a few examples of what your partnership campaign has done?
Perhaps the biggest thrust has been to try to pull together organizations and individuals from around the state who share the concern about the public health system, understand the need to improve it, and are willing to invest time and energy with us in trying to raise understanding and awareness and commitment within their communities.
And what are some ways that we can, or what are some opportunities that we can do here in the state to improve our public relations campaign around public health?
Well, we've now got a new Department of Public Health as of July the 1st, and that I think was a huge first step. As a matter of sort of historical importance, public health really lost its voice over about the last 30 years due to some decisions made back in the 70s. And with the establishment of the new department, we've got an opportunity to begin to change that. And I hope and expect that the new department will take that on as a major commitment. If you look at public health systems around the country that are doing well, clearly a strong communications competency is right at the center of what they're doing.
And I would imagine that websites and all the other social media are ways to start that health communication process.
It absolutely is, and you know, I'm already seeing some signs of improvement from within the department, and I have every expectation that they're going to continue to build on that.
So Charlie, I know you've been a businessman here in Georgia for many years, and you know, you're very interested in as I am as well, about the connection between our public health outcomes and economic vitality. Why don't you tell me a little bit about that?
That's been a really interesting part of this campaign. As we got into it, it occurred to me that I wasn't seeing that connection, that understanding on the part of either business leaders or a lot of political leaders between the health of a local populace and the strength of a local economy at a community level or at a state level. I mean, you know, if you're sick, you're not as productive as you are if you're healthy. The same is true at a community level. But that understanding, it seemed to me, had sort of gotten lost. So we set out to try to see if we could reestablish it and pull together a couple of different data sets that showed that there's a huge overlap between the economic vitality of our communities and the health status. It's really profound, and I think that there is a lesson in there for policymakers as they address the issues we're talking about here today.
Great. Thank you very much for your time today. We're now being joined by Mr. Scott Maxwell of Matthews and Maxwell, Inc. And Scott is a lobbyist for the Georgia Public Health Association. I'm so glad you could be here with us today.
Delighted to join you.
Tell me a little bit about the Georgia Public Health Association, or GPHA.
Well, the Public Health Association is a group of people who get together, and their purpose in life is to improve public health in Georgia. The membership consists of people who may still work in the Department of Public Health, may be retired. Academics are involved. Often members of county boards of health are involved with the GPHA. So it's a group of folks who have an association to improve public health in Georgia.
And as their lobbyists, what is your role?
Well, my role is to go to the General Assembly and to state agencies and try to facilitate their agenda when it comes to ways that you can help public health. So it may be in budget matters or in policy matters.
And we have a new Department of Public Health, and I'm sure that you were involved with GPHA as their lobbyist. What exactly did you do in the formation of that new department?
Well, of course, my role was kind of a little bit logistics and a little bit education. Mickey Chanel was kind enough to offer to author the bill that created the department, so he was really the engine pulling the train on that. But my role was to visit with other legislators, visit with leadership, visit with chairmen of the appropriate committees, make sure they understood the bill correctly, see if they had any questions, do any follow-up, and then repeat the process over on the Senate side with Senator Unterman, who carried the bill over there.
So you use this word education. This has come up already today when we were talking to Charlie Hayslett, and he was talking about how his group does some health communication and education across the state. How does what you do in education differ or is the same as what his group does?
In many ways it's the same, but my target audience is a little different than Charlie's. I target the public policy officials in the state. Again, legislators, staff members for committees, staff and commissioners at state agencies, the executive department, those type of people. So my focus is with people who have been elected or play some role in the policy development of the state.
And how does your role as a lobbyist in the state of Georgia compare to what your role might be as a lobbyist in other states? I mean, are we different? Are we better? You know, what are the opportunities and challenges here?
Well, in many ways, Georgia's like other states. I think we have a large legislature compared to many states, 180 members of the House, 56 in the Senate, and lobbyists have to play the role of educator there. But it's not a situation like you might have in Congress where you have lots of staff members who can do the research for you. You have to depend on lobbyists and advocates who are able to explain in depth what the results of pending legislation may be.
Okay, one final question. You had this unique role as this new Department of Public Health was formed. What did you learn in the process, and what are your hopes for public health in Georgia in the future?
Well, I think what we learned is there's always more to it than you think there is, creating a new Department of Public Health. The debate that went on during when the Commission was studying the idea and when the legislature debated it was very interesting, and I think it gave not only me but a lot of other people the depth of idea of how much public health does in this state, how many areas they're responsible for, the many different venues that they're involved with. As far as hopes, that the new department will be so much more efficient than the way we have done things in the past, that we can spend the same amount of money and get so much more done. So I think it was a great bill for the legislature to pass, and I have high hopes under Commissioner Fitzgerald that it'll do great things.
You know, Phaedra, you and I are both in public health, and I have to tell you, this episode's been very encouraging to me.
Yeah, the structure is finally in place for us to move forward and advance that public health agenda.
Yeah, we have this Department of Public Health at the state level.
We also have our district public health officers.
We have all these county departments of public health.
And don't forget all the people at the community level and above who are involved in health advocacy and health communication. It's really, it's an incredible group of people who are here to help us all.
And I see you have your This is Public Health sticker on your cup.
I sure do. This is from the whatispublichealth.org website. And this sticker is just a reminder that public health touches everything we do. This is a clean glass of water that I'm drinking, and we know that public health is involved in the clean water we drink.
You know, we started out with those really lousy statistics for the state of Georgia in public health outcomes, but we have a path forward now.
We do, and it's all because of that new structure. And we just, need to remind ourselves that this is a process, and so it will take time for us to improve those statistics, but at least we're on the right path.
Well, this is encouraging, and we're going to cover other aspects of public health in upcoming episodes of PHI Public Health Impact. Please join us.